welcome to the StellaLife Innovator Series. I'm Liz Lundry, and today I have the pleasure of talking to David Schwab, PhD. He's a professional speaker, author, and practice management consultant who helps dentists grow their practice, educate their patients, and train their teams so the practices will be more profitable. He's previously served as Director of Marketing for the American Dental Association and as Executive Director of the American College of Prosthodontists. He's also worked with major corporations and private dental practices. As a prolific author, Dr. Schwab's practice management and marketing articles have appeared in numerous publications, including the Journal of the American Dental Association, Journal of the Canadian Dental Association, Dental Economics, and the Seattle Study Club Journal. Welcome, Dr. Schwab.
Thanks, Liz. It's a pleasure to be here.
Thanks for joining us today. So in your vast experience in working with so many practices and corporations, what do you think is the hottest issue among dental practices right now?
Oh, the hottest issue. Well, there are some issues that never go away. I mean, I deal a lot with staff training and I work with doctors and help train their staff all the time. But to answer your question specifically, I think the hottest issue right now is to help practices get off of insurance plans.
Yeah.
And it's interesting because I researched this. The very first dental insurance plan in the United States came out all the way back in 1954. And
Wow.
believe it or not, the amount of the annual reimbursement maximum in 1954 was $1,000. Sound familiar? And here we are in 2024, and a lot of dental benefit plans have a maximum of about $1,000. And I really got interested in this and started doing some research and did the math. And it turns out that if dental benefit plans had kept up with inflation, then they would be paying an annual maximum of $11,000 today. So we're trying to tell the doctors to practice 2024 dentistry, modern dentistry, based on restrictions that were put into place in 1954. But it gets worse. It turns out that, as we all know, in the last 2 or 3 years, we had the worst inflation in the United States than we've had in the previous 40 years. Now, they tell us, the government says, oh, this year, 2024, next year, 2025, inflation may not be that bad. I hope that's true. But whatever inflation we get, it's on top of the inflation we've already had, which, of course, people know every time they go to the grocery store. And certainly dentists know every time they try to pay their bills or make payroll. So the bottom line is that the gap between what the insurance company will pay and what it costs to run a dental practice now has never been wider. And that's why we're hearing from so many doctors across the country that they really want to get out of some of these plans.
Absolutely. And the premiums for everybody have gone up. The benefits have not gone up. And I remember when I started in dentistry in 1979, a crown was like $250 or something. So everything has changed except the benefits they provide. So we need to view it in a whole different way. So, what steps should practices take to get off insurance plans? Is it kind of a gradual process, or, I've helped offices do this as a consultant myself, but I'd like to, as an expert, what is the best way to proceed with this?
Well, first of all, I tell the doctors it's a personal decision. I mean, they have to really want to do this, and they have to look at how much of their income is coming from insurance, what the competition, the other doctors are doing, and how pervasive insurance is in their community. But if they've looked at everything and they decide, I really want to get off of this plan or all plans, then I recommend that it be a gradual process. So we can talk about do's and don'ts. One of the don'ts is, I always say, don't write a letter and send it out to all your patients saying we're dropping a plan. First of all, it's a negative message. A lot of patients are going to read that letter and say, well, I guess I need a new dentist. And if you use phrases like dropping the plan or out of network, that's negative also. It's a big stop sign. It invites patients to look elsewhere. We don't want that to happen. So what I recommend is to do a 6-month glide path. And if it's a practice that has hygiene in it, this works really well. When the patient comes in for hygiene, we can say to this patient, today we're going to be working with your insurance plan the way we always have in the past. But just to let you know, in 6 months, the next time you come in, because we've set a specific date in the future, we're going to have a little bit of a change here. we're not going to work directly with your plan anymore. And that's a key phrase. We're not going to work directly with this plan anymore, but you can still use your insurance. We're still going to file the claim for you, and we'll do everything possible to help you maximize your benefits. Now, we will ask you next time you come in to pay at the time of service, but we'll file the claim, and whatever reimbursement you're due, according to the insurance company and their rules and regulations and so forth, they will send you. And we'd also like to help explain this to you by giving you the letter. And now's the time for the letter. And we say, here's a letter that explains it. So we're handing it out to the patients one at a time and saying, please let us know if you have any questions. And what we say in the letter is it's nicely done. One of the phrases I sometimes use is, we cannot maintain our high standards and still participate directly with this insurance program. Or we have other phrases that say, we're not going to compromise our care by working directly with the plan. Depends on what the doctor wants to say. And we explain it in a very nice way to the patients. And I also work with the doctor and the team through Zoom or however we're going to do it to help them with the verbal skills and give them the confidence so that they can answer the questions.
Yeah, that's a really nice, gradual, compassionate way to do it for everybody. Less stress for the practice and the patients too. If they just get this random letter out of the blue, they feel like they're personally being rejected. Oh, they don't want to see me anymore. And there's a lot of
Well,
emotion that can
no,
be there.
well,
And
you're
this
right. As a matter
much
of fact, if you say in the letter we're dropping the plan, it sounds like you're saying we're dropping the patient.
right.
And so I've seen a lot of letters that weren't too good, and I managed to intercept and change ahead of time. But if we do it correctly, and most importantly, we've got to make the staff feel very confident. There's no apology. We don't say we're so sorry we're doing this. It's matter of fact. We're explaining it and doing the best we can. And just as an example of a verbal skill, if a patient says, well, I won't be able to come back here anymore because I want to stay with a dentist who accepts my plan 100%, we say, well, we understand, but we want to let you know there's no awkwardness here. If you ever want to come back for any reason, please do. You're welcome back anytime, and it's very easy to come back. And some patients do come back.
And I will say that from my experience of having seen this over the 30 plus years I've been doing trainings, those great patients that you love the most, they come back because they
They
really
do.
appreciate
Yeah.
you, love the relationship, and they miss you. So that's generally what we see. Then you can have the patient population you really enjoy seeing, which is
Mhm.
great. So what are the reasons overall that patients will or will not accept treatment? What can we do to be more effective with that?
I think so many times we relate it to cost, and it is an issue, but it's not just the dollar amount, it's the way it's presented, the confidence of the person who's presenting it, and also how much value that somebody can put when they try to explain this to a patient. So one of the things I teach the offices to say, if a patient is saying, oh, it's so expensive, or I had no idea, is to say, our fees reflect the quality of the services provided uniquely to you. And if we break that down, everybody wants high quality care. And we say provided uniquely to you, let's say the patient needs a crown. There are 8 billion people on planet Earth, right? That crown is custom made to fit one tooth for one person. You can't get more customized than that. So we want to emphasize that this is high quality, individualized healthcare and sort of imbue it with value. The other thing I always tell practices is make good use of programs like Care Credit, which is a wonderful program, and these other financing plans. Some doctors tell me, well, my overhead's high and I don't want to, quote, spend money on some of these plans. Say, look, it's always a good deal for you. And here's why. If you were to do advertising and you spent money, you would then hold your breath and hope you got a return on investment. But if a patient signs up with Care Credit or another financing plan, then you don't have to pay money until you've got a warm body in the chair, until you've got case acceptance. And you really can't lose on this deal. And it makes it easier for the patient. It takes some of the pressure off. They can spread it out over so many months. They can have no interest to pay. And honestly, it makes it more affordable, and it takes some of the sting out of what the patient is saying about cost. And I would just give you one other quick example to answer your question. I think in presenting fees and wondering how the patient's going to react, if possible, offer alternatives. So take one example. The patient is edentulous in one arch. And the treatment plan is, how are we going to replace the teeth in this one arch? Well, I'm going to use, I tell this when I lecture, I'm going to use some dental terms. If you're talking to a patient, you might want to take the time and put it all in layman's terms, but let's just save some time here. And I would say sometimes I hear a doctor say to the patient, well, we can do, explaining it in layman's terms, a fixed hybrid. Well, a fixed hybrid, it's a fantastic restoration option, but it's going to be at a fee that the patient's going to have to think about. So why not give three options? If the goal is to replace missing teeth, we can do one of three things. We can give you what's called a conventional removable denture that you take out and put back in. We can give you an overdenture that's secured by dental implants. It's much better. It's secure. You snap it in and out. Or, and you explain what it is, we can give you this fixed hybrid, which is state of the art, and only a dentist can remove it. Now the patient is now has three price points, which are very different. And the patient says, well, removable denture, that's what my grandmother had. I don't think I want that. So now they're thinking about this overdenture versus a fixed hybrid. And whatever decision they make, they can decide based on the benefits and what they're comfortable with, but they're between two good treatment options. They're not between yes and no. And I think that's a way to get patients more comfortable with the cost.
Yeah, absolutely. They have options and they also feel that they're in control. So that's really important, empowering for the patient as well.
Exactly. As a matter of fact, I always say one of my favorite words is options, because it puts the control in the patient's hands and they're making the decision. This is what I want to do.
Absolutely. They're in control, they're empowered, and they'll more often than not make the best decision because they feel that support, and that kindness and the compassion. So how do you convey treatment benefits when patients can't get past the cost, which, we always assume it's money. I have found it's usually a lot of other things, but let's say that is the obstacle. So how would you approach that?
Well, you're right, Liz. Sometimes it's other things, and sometimes it's a multitude of things, and cost is still in there somewhere. So I always like to convey value, and I like to touch on what I call the five pillars, no matter what the case. And I'll just tell you what they are, and maybe I'll give you an example. They are prevention, aesthetics, function, health, and quality of life. So let's say the patient is missing a tooth in the posterior, and they come in and they are not motivated. They say, well, I've been missing this tooth for a long time. They tell the dentist they've accommodated to it. They can eat. No one's going to see it. Why in the world should they spend money to fix a problem that they don't really see as a problem? And so we're going to look at those five pillars and work them in together. So prevention, and again, I'll use dental terms, but prevention, explain to the patient about supereruption of the tooth in the opposing arch, explain to them about shifting and moving teeth, which affects their occlusion. And sometimes once the occlusion starts to go, that one tooth problem becomes a full mouth problem. It becomes a cascading effect, and it could affect the aesthetic zone. And when you have moving and shifting teeth, you have crowding, which can make the patient more susceptible to decay and periodontal disease. So we want to prevent that. And certainly we talked about function, about occlusion, and now we're talking about health, because we don't want to have decay and we don't want to have periodontal disease. So it's affecting their health. If you put all these things together, the overarching term for all of this is quality of life. And everybody wants high quality of life. So it's not a question of it's a nice to have, we're just replacing this one tooth. We're doing this for all these reasons, for preventive reasons, for aesthetic reasons, for functional reasons, for health reasons, that add up to a quality of life improvement for the patient. Now that's valuable. And that's going to be more persuasive to a patient than just, everybody should have all the teeth they're supposed to have.
Yeah, and I've seen patients that one wouldn't think would be interested in aesthetics. I had it in a practice where I was working for a while. There was a lady who was in her 80s, and she wanted to finally have the beautiful smile she never had her entire life at that age, and was willing to make the investment and take the time. And she was so happy when she did that. So we need to, give everybody that
No,
opportunity.
you're absolutely right. It's so interesting. The ones you don't think are interested in aesthetics, that's your example. Then we've had examples of younger patients who got a complete, full mouth rehabilitation and looked fantastic. And I remember the lady didn't seem that enthusiastic. And the doctor kept saying, it looks wonderful. It looks great. Don't you think it looks wonderful? And she said, yeah, But the point is I can eat, okay? So for her, her motivation was more function than aesthetics. Well, she got it all, and the patients can pick whatever benefit that they like the most.
Yeah, that's right. And we need to read what is really most important to them, as we're trying to communicate with them.
Hmm.
So you brought up some great points, and I think given us many tips that will be easy to apply and very helpful. But you've done so much helping offices really get in there and make all the changes necessary to be more successful and profitable. So I know you lecture and you also do an office training. We'll have all that information up for our viewers today. So if you want to mention anything about that, you can.
Well, sure. I mean, I do a lot of lecturing, whether it's small group or large group. The consulting, it's usually a 6-month program. Some people only do a year, but I start with 6 months. I've had some people with me for a long, long time, but 6 months sometimes is all anybody needs. Depends on the treatment plan, right? And sometimes if it's something like getting off of insurance and it's very, very focused, we can just do it via Zoom and do a couple of sessions on Zoom, give the written materials, the verbal skills, and train the staff via Zoom in a very short period of time. And that's all somebody needs. So it's quite flexible. And yeah, I know you have my website, davidschwab.com, and everybody's welcome to a free consultation. I talk to doctors all day long and I learn what's going on in the country, and I try to help as many people as I can.
That is great. Well, thank you again for joining me today. And I really appreciate what I learned from you. And thank you all of you out there who joined us at the Innovator Series today. Please come back next time and we can all continue learning together and helping our patients get better and healthier and happier.
Yeah,
So
thanks,
thank
Liz,
you.
and thanks to StellaLife. I really appreciate it.
Thank you. All right, everyone, take care. Stay well. We'll see you next time.